You know that feeling, right? That frustrating, deep, chronic stiffness in your hips? You stretch, you hold it, you breathe, and for a little while it feels better. But that tightness, it just always comes back. Well, today we're going to dig into why that happens and, more importantly, what the real fix looks like.
All right, let's just get right into the big question, because it's probably why you're here. If having tight hips was just a simple flexibility problem, all that stretching you've been doing for months, maybe even years, would have fixed it by now. The truth is, the real issue is something else entirely.
So here's the core of it all, the big idea. On one side, you've got passive stretching. That's, holding a stretch. It feels good, but it's mostly just temporary relief. This is the stuff we've all been told to do forever. But on the other side, you have active strength. This is about actually moving through a range of motion to build long-term control. And that is the actual solution we're going to build on today. Okay, so let's break down exactly why that old just stretch it advice is, well, kind of flawed, and why it's probably keeping you stuck in that same frustrating cycle of feeling tight all the time. Now this is really the key. That feeling of tightness you have, a lot of the time, that's just your nervous system pumping the brakes. It's a protection mechanism. Your body is literally saying, whoa, hold on, I don't feel strong or stable here, so I am not going to let you go any further. It isn't just about how long your muscles are, it's about how much control you have. And this quote just nails it. This is the aha moment. To get your body to let go of those brakes, you can't just passively hang out in a stretch. You have to prove to your nervous system that you can handle that new range of motion safely. And how do you do that? You build strength there. Strength is the language your body understands. It's what tells your brain, hey, this is safe, we own this territory now. And that's what locks in that new mobility for good.
So if the problem is a lack of control, the solution is, well, it's pretty simple, right? We have to build it. We're going to completely shift our focus from just passive flexibility to creating active, usable mobility.
And this right here, this is our new goal, active control. It just means you own your range of motion. You can get into a position and, more importantly, get out of it using nothing but your own muscles. Think about it. It's the difference between just dropping into a deep squat versus being able to lower yourself into it with absolute perfect control the entire way down and back up.
Okay, theory is awesome, but let's get our hands dirty. Let's make this practical. I'm going to walk you through 4 simple but super effective movements that are designed specifically to build this active control in your hips.
First up, we are going after the hip flexors. You know, that spot at the front of your hips that gets so tight from sitting. But instead of just a lazy, passive lunge stretch, we're going to use this deep lunge lift to actively wake them up and make them stronger.
Okay, here's how you do it. You're going to get into a pretty narrow split squat stance. Maybe put your hands on a chair or the wall for support. Once you feel balanced, the real work starts. I want you to use the strength of that front hip flexor to lift your back leg straight up off the ground. Squeeze and hold it for just a second at the top. And then, this part is so important, lower it back down slowly. No plopping, control it. And to make sure you're really doing this right, you should feel this working not just in your hip, but kind of deep up into your lower abs. Once that feels pretty stable, you can make it harder by inching that back foot further away. And the ultimate challenge? Doing it completely hands-free. When you can do that, you know you really own this position.
All right, move number 2 is the hip airplane. Seriously, this one is a game changer for hip stability. If you've ever watched yourself in the mirror doing a squat and seen your knees kind of wobble or collapse inward, this is the move for you. It's going to target those deep rotator muscles that stop that from happening.
So here's how it works. Stand next to a wall. Put one hand on it for balance. Then shift your weight onto one leg and hinge forward, like you're doing an RDL. Now here's the magic. Super slowly and with total control, you're going to rotate your torso and hips inward, like you're trying to close them toward the floor. You should feel that outer glute on your standing leg light up. Then, just as slowly, reverse it and open your hips back up. The key word here is S-L-O-W.
Next up, the glute bridge. I know, it's a classic. But honestly, so many people miss the entire point of this exercise. When you do it right, it is one of the best ways to fire up your glute max, your main hip extensor. And that takes a ton of pressure off your lower back when you're lifting things or even just bending over.
We're just going to focus on fixing 2 super common mistakes. First, people put their feet too far away from their body. When you do that, your hamstrings do all the work. The fix? Easy. Just scoot your heels in a little closer to your butt. Second, people crank their hips way up to the ceiling and arch their back. Don't do that. Just lift until your body forms a perfectly straight line from your shoulders to your knees. That's the sweet spot for pure glute activation.
And our final move.
Hip CARs. CARs stands for Controlled Articular Rotations. It sounds kind of technical, but the idea is simple. This one does two incredible things at once. It builds strength through your hip's entire range of rotation, and it develops the active control you need to get into deeper, stronger, more stable squats.
Okay, so you'll start on all fours. Now the absolute key here is to keep your torso perfectly still. No rocking, no twisting, nothing. Then lift one knee up and draw the biggest, slowest, most controlled circle you possibly can. I want you to imagine your knee is scraping the inside of a giant barrel. All the movement has to come from the hip joint itself. Do a few circles one way, then reverse it. This builds an incredible mind-muscle connection.
So how do we pull all of this together into something you can actually use? Well, it's surprisingly simple. Let's build your new super efficient HIIT routine right now.
And here it is. It's just one set of 10 deep lunge lifts on each side. One set of 10 hip airplanes on each side, 2 quick sets of 15 glute bridges, and one set of 10 hip CARs in each direction, on each side. That's it. That's the whole shebang. A powerful, targeted routine that takes, 5 or 6 minutes?
And I absolutely cannot stress this enough. Rushing through these moves to just get them done will not work. The goal is quality over quantity. It's focused, intentional movement. Doing this just a couple of times a week, but with real focus, is going to make a world of difference.
I mean, think about it like this. Those 5 or 6 minutes of focused, active work where you're really concentrating will do so much more to actually fix your hip stiffness for the long haul than 30 minutes of just mindlessly sitting in a stretch while you scroll on your phone. You're teaching your body new skills, not just pulling on it.
So I'll leave you with this question. By shifting your focus away from passive stretching and towards building active strength, you stop chasing that temporary relief and you start building permanent, usable mobility from the inside out. Give it a shot. You might be surprised at what 5 minutes can do.